Today we are going to start our first chapter, which is preoperative evaluation. Inadequate preoperative planning and error is the most common cause of anesthetic complications. To assess a patient preoperatively, his history should be taken, he should be physically examined, laboratory evaluation should be done, and the patient should be classified according to ASC classification. These are the four categories which should be done before surgery. Anesthesia and elective surgeries should not be proceeded until the patient is in optimal condition, for which other specialists should be consulted too. History should be taken and the patient should be looked for current or any other known problems, and he should be asked about medication history, whether he had any allergies to certain drugs, drug intolerance, present therapy if he is taking any, alcohol and tobacco intake he should be asked about. He should be asked about previous anesthetic history and what was his experience if he had a surgery before. He should be asked about family history of malignant hyperthermia etc. Every organ of his should be reviewed and questions should be emphasized on cardiovascular, pulmonary, endocrine, hepatic, renal and neurological organ systems, and positive response to any of these questions should promote more detailed inquiry. Last, oral intake of his should be asked about. In physical examination, vital or signs should be looked for and measured. For example, blood pressure, heart rate, respiratory rate, and temperature, airway, heart, lungs, extremities, and neurological examination should be done. All of these should be done using standardized techniques of inspection. For example, auscultation, palpitation. Patient dentition should be inspected for loose or chipped teeth. If the patient is not in optimal medical condition, he should be referred to other specialists for consultation. An asymptomatic patient should not be recommended for any of the testing, but many physicians still order for some tests like hematocrit count, hemoglobin count, urine analysis, serum electrolyte measurement, coagulation studies, electrocardiogram, chest radiograph, etc. But if the patient is in optimal condition in history and physical examination, you should not be ordering any of the tests because they could be expensive. Number 4 is ASA classification. In ASA classification, the patients are classified into 6 classes. Number 1, normal patient. Number 2, patient with mild systemic disease but no functional limitation, for example, pregnant patient. Number 3, patient with severe systemic disease and some functional limitations. For example, COPD patient. Number 4, the patient with severe systemic disease and functionally incapacitated patient. For example, cardiac ischemia or severe valve dysfunction patient. Number 4, the patient who is not expected to survive without operation. For example, patient with massive trauma or intracranial bleeding. Number 6, brain dead patient for organ transplant. The surgery should be done. E is the emergency surgery. Informed consent. Informed consent should be taken before every surgery. The patient should be given information of the procedure and risk related to the procedure. If if a physician doesn't take a consent before surgery, he will be liable for assault and battery. If patient is not able to give consent, parent, guardian or close relative should be asked for a consent. All consent should be enough, but written written will be best.